Good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Wednesday, June 17th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Brad, thank you and good afternoon. While we remain focused on fighting COVID-19, we have also been very focused on confronting anti-black racism, and I'm going to devote a good portion of my remarks to that matter today. On Friday, the Toronto Police Services Board will consider a report with recommendations on how our police service can begin to step up its efforts to confront anti-black racism. We're at a tremendous moment in our history where people around the world and here in our own city, while facing this unprecedented pandemic, are also totally engaged in confronting anti-black racism and anti-Indigenous racism in our society, including in policing. We must not miss the opportunity to take advantage of an unprecedented consensus on this. We have responded well and together to a sudden pandemic called COVID-19. Now, it is time to put the same determination, the same creativity, and commitment to work going after a centuries-old pandemic called racism. I want to be clear to the public that the work and the listening involved in taking this on is continuing in our own city. I am meeting with people and listening to people every single day to hear how we can do even better when it comes to these issues in our city government and across the city itself. I am working continuously with members of the Police Services Board and members of the City Council and other community leaders to make sure that we are doing everything we can to stop anti-black racism and to dismantle systemic racism in our city. I fully support accelerating the pace of police reform in Toronto, and I believe the recommendations going to the board this Friday will result in real, tangible changes that will produce better, more accountable policing. This is a moment not just to do better, but to do right. If approved, as I fully expect it will be, this report will see the Toronto Police Service continue to make changes to focus police officers on major crime, improve how we respond to residents experiencing a mental health crisis, and to require the additional training that will contribute to a rebuilding of trust. I have been directly engaged in the initiation of these first steps, and they are first steps. I will support them at our upcoming board meeting, and I'll be looking for further steps to be taken, both by the police board itself and by the upcoming meeting of the Toronto City Council. I also want to be clear that these are the first steps the board can take now, some of them accelerating reforms which were already underway, and including things like body-worn cameras, which will hopefully receive final approval at the July meeting just a month from now. I am working closely with colleagues on City Council, all of whom are engaged on this issue, and will be bringing forward further recommendations for change to the meeting at the end of June, the City Council meeting at the end of June. Some of the other changes that need to be made in the area of policing will have to come from the Government of Ontario. I believe it will also be important that the Police Board and City Council both make it very clear what changes must be made in order to help all municipalities across Ontario to usher in sensible, meaningful policing reform. ActiveTO has been a well-timed, well-executed, sensible, and yet comprehensive program that has created a network of space for people to get out and move all around our city. We have new data to share today about the ActiveTO major road closures we've had over the last few weekends. I think you will all agree that this data reinforces what we've been hearing from people, that residents, including families, like these spaces because they allow for safe physical activity, and those using them feel more comfortable and secure that they are doing their part through physical distancing to stop the spread of COVID-19. The major road closures on Lakeshore West, Lakeshore East, Bayview Avenue, and other streets surrounding those areas are intended to make space for residents each weekend to be outside, to be physically active, and respect physical distancing while enhancing their overall well-being and keeping them safe. It is also meant to reduce crowding on the Martin Goodman and Lower Don trails. Data from the first weekend, on which all 3 locations were in place at the same time, which was on May 23rd and May 24th, shows that residents have benefited tremendously from this space being made available to them. On Saturday, May 23rd, the numbers for both Lakeshore Boulevard West and East closures include the roadway closure itself as well as the adjacent Martin Goodman Trail and the boardwalk. And those numbers are 21,000 people on bikes and 4,400 pedestrians on Lakeshore Boulevard West at Ontario Drive. 5,000 people on bikes and 5,400 pedestrians on Lakeshore Boulevard east of Coxwell Avenue, and 4,700 people on bikes and 1,000 pedestrians on Bayview Avenue north of River Street, plus 3,400 people on bikes and 750 pedestrians on the adjacent Don Valley Trail. These numbers were derived by way of counts done by the city's traffic counting contractor. They take video recordings that are then processed using software as well as manual checks and verification. This is technology that is used in many different places and used by us in a lot of the planning work we do in the transportation area. I should note that since that weekend, we have doubled the Lakeshore Boulevard East closure. It now stretches more than 2 kilometers from Leslie Street to Woodbine Avenue. These were tremendously popular trails during warm, sunny weekends before COVID, and they continue to be extremely popular as people seek ways to respect physical distancing while at the same time being physically active. Staff continue to monitor these closures and make adjustments where necessary to improve movement and to manage nearby traffic. I should take this opportunity to remind everyone that these major road closures will be in place again this coming weekend from 6 a.m. Saturday until 11 p.m. on Sunday. And I strongly encourage all of those using these routes to get to and from these locations, ideally by bike or as a pedestrian. This weekend's closures again include more than 10 kilometers of space. I'm also very pleased to announce today that the ActiveTO cycling network is ready to take its next step and to grow again. At my urging and approved by the Toronto City Council, staff have prioritized cycling routes that provide a relief valve along transit lines and support our hospitals and frontline medical workers. By the end of this week, we will have a safe, temporary bikeway almost fully in place along University Avenue. This will help provide an alternative to transit and to driving that we will need going forward, as well as a safe, connected transportation option that our frontline workers need and want. All the hospitals around University Avenue have come out in support of this project. The bikeway on University Avenue, Queen's Park Crescent, will be 2.3 kilometers between Bloor Street and Adelaide Street, and it will help us to improve connections to essential services, including hospitals. It will help us to provide capacity to Line 1, capacity relief to Line 1. It will help us connect people on bikes to existing bikeways on Harvard Street, College Street, Richmond Street, Adelaide Street, and soon Bloor Street. And it will deliver an all-important route in creating the major citywide cycling corridor identified in Toronto's 10-year council-approved cycling network plan. We continue to deliver more cycling routes quickly using temporary installations by repurposing curb lanes along several key corridors, many of which are already identified in the council-approved cycling plan. The staff of the city are simultaneously delivering permanent cycling routes that have been approved as part of the 2020 cycling program. So there's a lot going on of a permanent and temporary nature. For example, on the permanent side, planned separated bike lanes along Douro Street and Wellington Street will be completed later this week. And staff are well on their way in design and installation planning for ActiveTO routes along Bloor Street between Avenue Road and Sherbourne Street and Bayview Avenue between River Street and Rosedale Valley Road. Finally, today I want to applaud the Toronto Transit Commission for making the right decision today to make face coverings mandatory on the transit system effective in just a few days' time. This decision, which I fully support, is based on public health advice to stop the spread of COVID-19 in our city. While this mandatory face covering requirement doesn't come into effect until July 2nd, I encourage everyone using the TTC to make sure they are wearing a face covering now to help protect and respect their fellow riders. All of this is in furtherance of our public health goals, to wipe out COVID-19 and to see us move further down the road to a safe reopening and recovery for the City of Toronto. Knowing that is our shared objective, I will now ask Dr. Davila for her update for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 86 new COVID-19 infections in Toronto. To date, 11,397 people have recovered, an increase of 202 since yesterday. For more detailed data on the status of COVID-19 cases in the city, I encourage you to visit our website. I wanted to remind you that our COVID-19 monitoring dashboard, which tracks our progress, is also available online. This dashboard helps us assess how we are doing in terms of achieving our COVID-19 response objectives to prevent loss of life, preserve the capacity of our healthcare system, and minimize social, economic, and broader health impacts. Today's updated dashboard continues to show that while our status remains yellow, we continue to move in the right direction. Of particular note, our new case counts and new hospitalizations are decreasing each day. The steady decrease in new COVID-19 cases is a result of your continued efforts. Together, we have made a lot of progress through your commitment to our public health measures. These protective measures and restrictions have saved lives, but we also know that this has come at some expense, including the economic, social, and personal well-being of many of our residents. This is why, as mentioned on Monday, equally important as our numbers is our progress against our COVID-19 objectives to assess our readiness to safely reopen. Taken all together, our progress will be assessed on when the timing is right for us to safely reopen. And as we move further into the recovery phase and get ready to proceed to stage 2 of reopening, it is critical that we provide support to our local businesses and community to help them to be ready. As I shared with you late last week, my team has been preparing guidance documents to support the safe reopening for our local businesses and community organizations. All businesses and organizations need to adjust how they operate to reduce the spread of COVID-19. Whether you're a business owner or operator, an employee or a customer, it is important to stay informed to understand what our new normal will look like in the months ahead. There is a range of guidance documents we've made available online, each developed to address the unique circumstance of different types of workplaces and community settings in our city, from businesses to not-for-profit services, farmers markets, and many other settings. My team continues to expand these online resources, and I encourage you to take the time to read them. We continue to receive questions about the series of steps that restaurants, personal services settings, and places of worship need to take to safely reopen as we transition to our new normal, living with COVID-19. So today, I will provide some highlights from these guidance documents, as I understand that these areas are of particular interest. Our city has some of the best restaurants in the world. While we have been fortunate over the last few months to support our local businesses and access great restaurant food on a takeout and delivery basis, I know we are all looking forward to enjoying a summer patio in local restaurants in person. To make this safe for customers and staff, all restaurant operators will need to make specific adjustments. So when the province allows us to move to stage 2, restaurant operators will be permitted to provide dine-in service only on patios. Patios must be open to the air with umbrellas permitted for sunshade. Other required measures for restaurant operators include maintaining physical distancing, ensuring that staff and customers use cloth masks when it's not possible to maintain physical distance, and screening staff and customers for COVID-19 symptoms, to name just a few. Another important area on which my team continues to receive questions is regarding personal service settings, which include hairstyling and barbering, nail salons, and other aesthetic services. Guidance to keep clients and staff safe when delivering these services include regular cleaning and disinfecting before opening, after each client, and throughout the day, ensuring physical distancing of at least 2 meters or 6 feet, reducing the number of people on site, screening staff and clients for symptoms of COVID-19, ensuring customers are wearing cloth face masks when they receive services, and training staff to ensure that they understand the new cleaning protocols, when and how to use their personal protective equipment, and how to respond to questions. The last guidance document that I would like to highlight today is for faith-based organizations. While the province has already allowed faith-based organizations to hold in-person gatherings under certain conditions, faith community leaders are strongly encouraged to carefully consider how and when to reestablish in-person activities. This is because we know that religious gatherings tend to occur in indoor settings and are generally attended by older populations who are more likely to experience severe impacts from COVID-19. With this in mind, advice for faith-based organizations includes the following: restricting attendance to no more than 30% of the capacity of the premises, maintaining distance of 2 meters between all people as much as possible, encouraging the use of cloth masks, and perhaps requiring that cloth masks are worn in those rare circumstances that physical distancing is not possible, enhancing cleaning and disinfection, especially for high-touch surfaces, limiting singing, as this is believed to increase virus transmission, and deferring or postponing rituals that may contribute to virus spread. As we get ready to enter stage 2 of reopening, we must ensure that the public, businesses, and community groups are all using appropriate precautions to safely reopen. For all business and organization settings, when the province gives us the green light to proceed to stage 2, I encourage you to reopen only when you are confident you can do so safely. Please visit our website and look under the Community and Workplace Settings page to review the relevant guidance documents. Following this advice will help all of us to get back to enjoying our city safely while we live with COVID-19 in our community. We all need to continue doing our part to keep moving forward and to reduce virus spread. So please, continue to practice physical distancing, and where you can't consistently maintain that distance, please use a cloth mask. This is how you can help protect each other and do your part to reduce virus spread. I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. Tomorrow will be the 100th day of continuous Level 3 Emergency Operations Center operation. We continue to ensure that both critical and essential city services are being provided without interruption, as they have throughout the COVID-19 pandemic emergency. I'm proud of, and I personally thank, every member of our team who continues to work hard in support of our residents each day. This afternoon, I will provide our weekly personal protective equipment update. At present, our PPE levels remain stable, and our team continues to work hard to source the equipment that we need on a go-forward basis. Our current PPE inventory levels are as follows: a 33-day supply of N95 respirators, a 357-day supply of surgical masks, a 184-day supply of isolation gowns, a 170-day supply of face shields, and a 41-day supply of blood-borne pathogen-resistant medical gloves. Our pandemic reserve stockpile, which is in addition to the current inventory I outlined previously, is as follows: a 628-day supply of N95 respirators, and a 740-day supply of surgical masks. As you know, managing PPE has been a constant challenge throughout the COVID-19 pandemic. We have encountered and dealt with numerous quality control and supply chain issues with items of PPE that we rely on. The PPE task force continues to be one of the principal demand services operating within the Emergency Operations Centre, and I expect that to continue as we lead the city through restart. As a reminder, the amount of PPE that is used from day to day, which we refer to as the PPE consumption rate, changes based upon emergency response volumes and varying levels of activity across many of our services. As the consumption rates change from day to day and week to week, so do the corresponding number of days of current inventory that we report. My teams, including the PPE Task Force, are continuing to support the Office of Recovery and Rebuild as they work with the various divisions and agencies to bring city services back online. In closing, I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Before we go to questions, so reporters on the line know city staff are available for questions include Mary Ann Bedard from Shelter Support and Housing, Jacqueline Hayward from Transportation Services, Paul Raftis from Senior Services and Long-Term Care, and Carlton Grant from Municipal Licensing and Standards. First question is to Mark McAllister from City News. Please go ahead, Mark.
Thank you, Mayor Tory. Could you give us your thoughts on the incident involving the two black women and the bylaw officer at Centennial Park yesterday? And now we've heard, obviously, that Municipal Licensing and Standards will not be leading the investigation. Can you tell us why and who, in fact, will be doing so?
Well, first of all, these are deeply concerning allegations, and I think it is very important that when you have deeply concerning allegations like that, you do everything you can to ensure that the public is satisfied you are having an objective, independent investigation, so there's no suggestion that people are investigating themselves. And so in this instance, they're looking right now, the city is looking to find somebody or somebody that can conduct this investigation in an independent manner to get to the bottom of it and determine what happened. And I think, as I made clear last night, without prejudging what they're going to find, anything that involves intimidating or threatening or engaging in any kind of profiling or racial discrimination in our city has always been unacceptable to the city government and to the people of Toronto. And we will sort of have that as our guiding light going forward, and we'll see what the investigation produces.
Also a question regarding ActiveTO. It's come to our attention that there was a conference call involving city staff, some BIAs on Monday afternoon about some of the applications that have either come forward or going to come forward, and how there might be some difficulties as a result. Just curious, from your perspective, it has been said throughout that there would lessen red tape, but it seems like there might be some instances where there's going to be more red tape as a result of things not necessarily falling into the plans that have been set out already. Just wanted to get your thoughts on the matter and how easy or difficult is it actually going to be for some of these businesses to expand their patios?
It's going to be easy, and I will do whatever I can to make sure that it is easy, because the hard stuff has already been experienced by the people that are the bar and restaurant owners that have gone through 3 or 4 months of no revenue, no business, and are struggling to stay alive. And so I was unaware of that conference call, but I can tell you right now I'll be looking into it, and I'm going to make sure that what we do is what we said we were going to do, which was to make this a seamless process. It doesn't mean absolutely every application can be accepted, but it sure means if there's a benefit of the doubt to be extended, it is extended in favor of no red tape and in favor of the bar or restaurant that wants to do something, as long as it can be done safely, because we've got to help these people, and that is my going in and my attitude I will stick with all the way through this, to make this a success for people, but also for that business.
Okay, thank you. Next question is to Matt Bingley from Global News. Go ahead, Matt.
Hi there. Thank you very much. Mayor Tory, as of January, only about 55 new bylaw officers had actually received anti-Black racism training. I'm just wondering what your response is to that number, if you think that's acceptable, and if you think that that it's necessary to fast-track training for these individuals.
I think it is necessary for us to fast-track training for people who are in contact with the public. As you know, every city employee will receive the anti-Black racism training. I received it myself together with my whole team in the mayor's office yesterday. But every city employee will receive it, but I think it is important that we should prioritize those who are in constant contact with the public. Not that that means it's any less important for other people to receive it. It helps you a lot to understand some of the history of how we got to where we are and what we have to do to address it meaningfully inside the city government and outside. So I will be taking those numbers that you've offered and seeing what we can do to speed that up so that those bylaw officers who have extensive contact with the public, with all members of the public, will receive that training as soon as possible.
Okay, thank you very much.
Okay, no follow-up, Matt?
No, that's
Okay.
it for me. Thank you.
Thank you. All right, next question is to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thank you. My first question is for Mayor Tory regarding the incident, the encounter that took place yesterday at Centennial Park. The bylaw officer in question, is he still working in the public? Has he been suspended, or is he working desk duty?
I can only tell you as of the moment, because we're very careful about what we say about personnel files, that he is still employed by the City of Toronto. There's an investigation that has been begun and is now pending. And obviously, whatever happens with him, if anything, in the context of the results of that investigation, will be made public at that time. But as of the moment, he is still employed by the City of Toronto.
Okay, my follow-up is also for Mayor Tory. Earlier today, Mississauga Mayor Bonnie Crombie announced that a decision has been made to allow people to shoot off fireworks on their properties on Canada Day. She says Canada Day is just not the same without lighting up the sky. So I just wondered what the City of Toronto's plans are. I know that normally residents don't need a permit to shoot off fireworks on Canada Day. Is that still the case, or is there going to be any restrictions for them on their own property?
Subject to being corrected on this, I think we talked at the time of the May 24th weekend about the fact that people can do this on their own private property, but of course we emphasized the fact that people should be very careful about this. I understand the fact that there are not the kind of public fireworks displays that people often go to see on Canada Day, and that makes it both easier and safer, because it is safer when the city is putting these on as opposed to people doing it individually in their own backyards. There's a lot of hazards. Fireworks actually, since I was younger, have become much more powerful now in the context of what they produce, and that's more fun to look at, but it's also more dangerous. And so, we will take a look at what is in place prior to the Canada Day weekend, but I think the one thing we'll want to say to people is more so than anything else, just like we've said with regard to public health, take care of yourself, be respectful of your neighbors and of the people that you have around you in doing these kinds of things, because they do carry with them a certain degree of danger to people's own safety, and so we'll update on that as we get a little closer to Canada Day.
Okay, thank you. Next question is to Ben Spur from the Toronto Star. Go ahead, Ben.
Hi there. This is a question for the mayor. Today, the TTC board approved a plan to look at installing dedicated bus lanes on 5 busy routes. You've spoken in favor of this plan before, but do you have any opinion on how these things should be implemented? There are some concerns from transit advocates that perhaps they won't be very robust measures, that they'll just be signage or paint. Do you want to see some kind of physical separation here to actually prevent drivers from occupying these bus lanes?
What I want to see is the most sensible plan, and I don't think there's a kind of blanket approach you can say for the half a dozen routes or so that were brought to my attention in the plan that the Commission had to take a look at this. And so while the motion today was passed to say hurry up on that, which I agree with, I would still want to make sure we do it in a thoughtful way, which doesn't necessarily mean a cookie-cutter approach. I want these to be effective. There's no point in doing them if you're not going to have them effective in the sense that you can move all those hundreds and thousands of people along. There are thousands of people who use these bus routes far in excess of the number of people who are driving cars on the same roads. And the objective, as it was with the King Street Transitway, is to move the thousands of people better and have it as an encouragement to take transit as opposed to anything else. And so I will be quite happy to be sitting with Mr. Leary, as I do on a very regular basis. We meet all the time to discuss what the results are of a professional, careful, evidence-based examination of what the best options are, so that when we do it, it'll be done well, it'll be done right, and it'll move people along, as opposed to just being, paint on a street or anything else. It'll be what's effective and what's called for in the different places that these bus lanes are contemplated.
And as a follow-up to that, the King Street pilot, of course, was met with a lot of controversy in a part of the city where, I think it's fair to say that there's a lot of support for transit and perhaps less emphasis on driving. These routes are going in on outside of the downtown core where people do rely on driving to a greater extent. Do you expect this to cause a lot of controversy and to get a lot of pushback from residents?
There's not a single thing you can do in the job that I hold that doesn't create controversy somewhere with somebody. But what you have to do is keep your eye firmly on what is in the broader public interest, what is going to build the city going forward into a city that can move people around, give people opportunity, make sure there's housing for people with all kinds of different needs. And so you focus on doing what is right, you focus on doing it in a sensible way, and that's why you look at different options for doing things like bus-only lanes. But you move forward, because the city isn't standing still. It's the fastest growing city in North America. I'm proud of that, and I want it to stay that way, because that means people are choosing the way of life here and all the things we have to offer from around the world. But every one of these things has controversy associated with them, and we'll just have to move ahead and do what we think is right. You can never go wrong doing the right thing.
Okay, thank you. Next question is to Jennifer Pagliaro from the Toronto Star. Jen, go ahead, please.
Hey there. This is for Mayor Tory and Dr. Davila. The province has been saying that those areas that have not yet been included in stage 2, that the target reopening in that phase is for June 26th. And I'm just wondering for both of you whether you think that is a reasonable target date, especially given what Dr. Davila said about the indicators thus far.
So I'll start off and say that, yes, I am heartened by the way the indicators are going, and I do think that there is a lot of promise, and I know that we're certainly eager to get our city back. But if I can borrow from the mayor's answer to another question on a different topic, the real issue is around making sure that we're doing the right thing, following the evidence, following our data, and ensuring that we've got the right circumstances to open our city safely so we can continue to enjoy the great city that we call home.
I'll only add this. I've had numerous discussions with the Premier and with his ministers about this, and I've focused very much in my own mind on doing the right thing in the best interest of, yes, public health first and foremost, but also we have to take note of the people that are struggling out there, individuals and businesses. And I've said all along, and I'll repeat, we should focus less on the calendar and less on a particular date. It could even be the case that we could do this sooner than June 26th. When I say we, that the province and all the people involved in reopening, but it should be done based on the evidence and based on the best assessment that everybody can offer, including very much at the forefront the medical officer of health, obviously, and the provincial one. But we should do the right thing in the right way at the right time, and I think that's what everybody's focused on doing. And I'll repeat one more time, there are no two people in the province of Ontario, I would say in Canada, that are anxious to see Toronto, in particular, reopened as soon as possible than the Premier of Ontario and the Mayor of Toronto, myself. And so, but we have to do it in a way that is responsible, and that's exactly what we're trying to do based on the expert advice we both receive.
And just to follow up on that with Dr. Davila, I appreciate that these indicators are now available for us to see and the goals attached to each of those. But I'm still trying to make sense of, how we get from yellow to green. It seems to me like they're weighted in some way that just isn't apparent on the public-facing side of this. It's yellow overall, but the majority of indicators are actually green. So can you help us with that? Can you provide a bit more information on what it is that really needs to change in order for us to get to green?
Well, you'll note that, without taking you into a complete and total deep dive into the monitoring dashboard as it stands right now, We do note that there are indicators that are not quite at green yet. There are a number that are at green. Public health capacity, for example, and healthcare system capacity are sitting in favorable positions because all indicators have reached their targets. However, in the area around testing, we have some significant improvement that needs to occur, and that is outside of the scope of our control at Toronto Public Health. We are, of course, working with our laboratory partners. That's under provincial purview to make sure that everything that can be done is being done to improve those turnaround times. It's very important, not only now, but as we proceed into the future. But when I look as well at the virus containment and spread indicators, we are hoping to hit goal on the trend of new cases. We want to see that 7-day moving average in respect of new COVID-19 cases really continue a decline and have 14 days of consistent decline. So it's the combination of those different indicators that need to be taken all together in order for us to move from yellow to green. And it's about hitting the goals as described on the monitoring dashboard. But as the mayor just said, and as I've tried to repeat, it's not about a date. It's about actually getting to the right conditions so that we know that we can reopen safely. If we look at the experiences of other jurisdictions, reopening means more activity, more movement of people, more interaction of people. We know that we should expect COVID-19 activity to increase as a result, and we want to situate ourselves in the best position to manage that and to ensure that we're able to get our city back.
Okay, thank you. Next question is Jeff Gray from the Globe and Mail. Go ahead, Jeff.
Thanks, Brad. Question for the mayor just about the proposals that are coming forward to the police board on Friday. One regarding the mobile crisis intervention teams, and a call to expand that, and you know, even possibly hive that off, I think, if I read it correctly, into a separate service. But you know, we've heard the criticism of those teams for years, that there just aren't enough resources, that they're not available 24 hours. But why is it only now that we're looking at expanding that?
Well, we have, in fact, done some expansion, but I think the fact is it's been too modest, because we're seeing that too many cases of people in crisis end in tragedy of one kind or another, including people losing their lives. And that has included a disproportionate number of people from racialized communities who lose their lives in these kinds of episodes. And so I think that what we're now doing is going to take the step significantly to increase using existing budgetary funds, increase those numbers of teams. And it's not as simple as just saying you're going to do it. You've got to recruit and identify professionals, nursing and mental health professionals, to formulate these teams. But then I think the more significant part is that we are doing it as a measure, an interim measure, while we examine the possibility of taking all of these calls, 32,000 calls of people in crisis that the police face every year, and asking that fundamental question, which is, are these calls that the police are best able to handle, or are we better off to have those calls handled by mental health professionals, with the police then available to be called in if there are characteristics of those calls that require the presence of the police. And we're going to have a thorough but expeditious look at that. Expeditious in the sense that we're not going to take years to study that question, because I think it's an important question that's on the mind of many.
Follow-up, Jeff?
Oh, sorry, can you hear me now?
Yeah, go ahead, sorry.
Yeah. Oh, yeah, just wanted to follow up with another part of that proposal, which is this line-by-line budget that will be made public. How is it that in June of 2020 there is not already a line-by-line budget for a $1 billion police force in the city of Toronto?
I don't know the answer to that question. I think the people who have served with me on the police board know that I have been quite accepting of the fact we should make the line-by-line budget I see, which goes into, you know, considerable detail, available. It's something that but there has been one available that is more complete than used to be the case years ago, but it's not as complete as it should be. For example, the one that is put out presently and has been put out for a few years now is more detailed, but it still has sort of a couple of lines that cover off the 90% of the budget that's represented by salaries and benefits. What I see as a member of the board is something that might have 30 lines that break it down by salaries, uniform, salaries, civilian, benefits, overtime, and things like that. I see no reason, other than things that would compromise the police, their ability to have strategies for investigation and so on that might be compromised by revealing certain budgetary numbers, not to make all this information public. I mean, people could do the math. And so not only are we going to do that, I hope, if the board passes the recommendation I was very much involved in putting together with other board members and staff, but we're also going to have now more meaningful public consultation on the annual budget so that people can come and talk about the budget, members of the public, and have input on that before it's finalized. And you might ask, why have these things not changed before now? Because they haven't. But we're going to change them now, and we're going to do it with a degree of determination and a swiftness that I think takes advantage of a consensus that exists at the moment that we need to see change, and we're going to bring it about.
Okay, thank you. The final question is to Mike Crawley from the CBC. Mike, we're going to try your audio. I know we had some problems earlier, so give it a go. If not, we can get Chris here at at City Hall to ask a question for you. Can you hear me, Mike? No. Okay, so Chris Dunseith, our camera operator here at City Hall, will ask Mike Crawley's question on his behalf.
This is for Dr. Davila. Of all the indicators on the city's dashboard for the status of COVID-19, the only ones that are in red are about laboratory turnaround times. Will they alone hold Toronto back from advancing to stage 2? And what do you know about why the lab system hasn't made the progress that it should so far?
So thanks for that question, and thanks, Chris, for helping out with asking it. When it comes to those indicators, clearly they're outside of the scope of our control. And when we think about the use of the monitoring dashboard in terms of helping us make reopening decisions, I don't think we will hang things up on a single or even two indicators. It is the sum total and the complete picture that actually I think is relevant in terms of making the decision. With respect to what's happening at the labs, certainly I can tell you that we're talking about a new virus, new tests that had to be ramped up very quickly. This is, however, outside of the scope of control and outside of the purview of Toronto Public Health. So I can't speak in details around what seems to be the challenge. We are having conversations with those who are in charge of the labs, and they assure us that they are working very hard to try to address those challenges, but I don't have specific details. Suffice it to say, though, that what we are looking at is, are we ready as a city? Have we taken all the steps that we can that are within our control? And do we feel that overall we are able to manage a safe reopening? And that will not hang on any one particular indicator per se. It is the sum total, thinking about the objectives of the COVID-19 response as well.
Okay, thank you very much for joining us, everybody. We'll be back here again this Friday, June 19th at 3:45 p.m.